Since childhood, I spent a lot of time with my grandparents. And I guess that's the point where I got connected with this population. And this is a connection, it's been built with a lot of compassion, care. And this is a profession what I realized that if I give my best treatment and care plan, I can make some positive changes in people's life. In India, I was working in few clinics, and I was also working with NGO where there was kids with special needs, and also in the senior sector. I did my graduation followed by residency from India, and when I came over here, I completed my license exam to get my registration of physiotherapy. There are residents where you feel that they are sometimes very, very weak and it's a long way to go, and when you get the results with your effort, it's very much gratifying. So my life starts as I come in the morning. Most of the time I'm feeling that I'm spending more time with residents and less time with documentation. It's very important to interact with residents to come out with their condition and whatever the condition is. I'm very much fortunate and blessed working over here because here is a wonderful team of PSW, recreation therapists, kinesiologists, then nurses, and the best team is like where there's a good communication. And if we respect each other talent, everyone brings their own strength. So a good physiotherapist should have a good listening power, because when you are interacting with the resident, sometimes we miss like what they are going through with their own past experiences, and we are just focusing on the medical history because everyone has their own individual needs. Second, what we do with the less communication, I try to demonstrate to them whatever I want them to do. I do first with my team, or I try to explain their condition through pictures so that they understand what I'm dealing with, what my treatment will look like, and how we will move forward. So I try to create them at ease. Then also it's very, very important to be positive. So I try to motivate my resident to remain positive with their treatment plan. So I try to involve them whatever I'm doing. Few residents we do not find difficulty to make them follow our instructions, but there are a group of residents who are limited verbal communication and the people living with dementia. It's very important that we give them choices instead of telling them what to do. If there is a two goals, one is balance and walking, I will give them choices to make what you want to do first, either balance or going for ambulation, and they feel dignified like they have been asked for that. What I like the best is when the resident comes and I do the assessment. Sometimes they were having a good functional mobility in the past, but might be they landed up with fracture or some chronic condition or any systemic disease. When I see that that resident is walking independently, or maybe walking with a walking aid, or maybe with assistant but still is walking, that's really gratifying. It's a sector where you need a lot of responsibility, a lot of compassion, a lot of care, and it's a population where you really want to give impact to their lives. I'm so much passionate about this, and it's a fantastic experience, I will say, to work over here in long-term care.